Your physician has ordered the doctor's data microbiology culture for stool. You will see the contents of the kit outlined here on the table. I'll direct you first to the test requisition form. This test kit is billed directly at the time of service, and so you will notice that it will say billed to physician's account, and then a little bit later on in this it'll say physician's credit card on file. We do not bill insurance for this test. It will be cash pay bill at the time of service for patients. This section here, box number 2, may or may not have the physician's signature with their NPI number and the date that was ordered. If it does not have this information, that does not affect the ability for the test kit to be processed. So do not worry if this information is left blank. We have ordered the microbiology profile, so there will be a check mark here. If there is not, feel free to put a check mark there. You will have to note here the date the sample was collected when you do end up collecting this sample. So this will be for you to complete. There will not need to be anything else that's included in the rest of this box here. Box number 4 will be the patient information. The staff may or may not be able to complete this section here with your name, date of birth, mailing address, all of your demographic information. If it is left blank, please feel free to include this information here with a nice legible handwriting, and then making sure to sign here at the bottom with that X and then the date, noting that you understand this responsibility statement here. Box number 5, the only thing that needs to be marked is this physician's box. You do not need to put any of your cash or credit information here in this section because you had already paid our office for that. And then box number 6 will be left blank or even just crossed out because, like we mentioned, there is no insurance that will cover for this test kit here. In order to prepare for this test kit, you'll make sure that you read through the instructions here nice and thoroughly. It does say, making sure that we want to make certain that you understand what's going on as far as the preparation that's needed for this. If you are taking any sort of antifungal or antibiotic, please complete that course and then wait 3 days prior to collecting your stool sample. Do not take any sort of digestive enzymes, antacids, aspirin, or probiotics for at least 2 days before you collect the specimen because that will greatly impact the results that we see. There's just some information based on, just kind of letting us know what is in the test kit, so make sure that you see all of those things there. And then there's a really nice detailed written instruction for the collection that is on this second page here. What we will do is open up this container here just to line some of these things out on the table. Within this specimen bag, you will notice that you have 1 pair of gloves that are latex free, a little paper towel, and this specimen collection with some liquid on the inside. You'll see that the liquid does go up to about the midway point of this vial here. If it dips below there or there's any signs of leakage of this vial, please contact the company and they have their information here to let them know that there was leakage. If there is leakage by the time that it gets to them, they cannot process the sample. So it's important that this vial is, nice and filled there. In order to collect, you will have a full urine prior to getting your stool because any contamination of toilet water or urine within the stool sample will make it not able to be tested. So you'll have, complete your urine and then you'll start with your defecation in this container here. It's okay if it's, diarrhea or liquid or whatever consistency it is because we just want to make sure that we're testing that stool there. So you'll have a bowel movement into this container, put on your gloves, open up this container, which I will not open here. Just to note, this is a toxic solution that's in here, so make sure that the kiddos stay away from it because it can cause some pretty decent poison symptoms there. Tap down on the lid to make sure all that liquid has dropped into this vial. Open it up. You will notice it's difficult to see here on the video, but there is a little spoon that's attached to the top of this lid here. With the gloved hand, you'll take with this lid in your hand, you'll take from the beginning part of the stool or the first part that came out of you and put it into this container. You'll take a piece from the middle portion of the stool and put it in here, and then the very last portion of the stool that came out and put it into here. It's very, very important not to overfill this vial here, because if it's overfill, it might rupture in transport, which I certainly would not want to deal with, and the lab does not want to deal with either. So making sure that you're, once you put the stool in here, it will displace that liquid and push it up towards this red line. Please make sure that it does not go any further. If you do notice that it has started to go a little bit further, take out some of the stool, only making sure not to get any of that liquid out, using the spoon that's attached to this, and then just discard that extra stool. Once that's completed, you'll make sure that this is nice and twisted on very, very tightly here, and give it a good shake to mix it. You'll make sure to label with your name, date of birth, date and time collected, as well as what your stool looks like. This is more formed, looser, and then water is this fourth section here. Once that's completed, you can discard of the stool that's left in this boat here, as well as the pair of gloves. Making sure, again, this is nice and attached very tightly here. You'll wrap this paper towel around the vial. Place it into this bag here. And then you'll seal the zipper, making sure the air is all taken out. You'll open up the box. Put it just like so, does not need to be shipped on ice. And then this will go in here just like this. What's really important with this stool sample collection is it does need to be shipped out the same day that you collect it. So optimally, you would have this done first thing in the morning and then ship it out that afternoon. You will see that you have a FedEx billable stamp label that's prepaid. You're welcome to put your return address in the from section. The address that it's going to is listed here in the to section. You'll open up this bag here, just like so, and place that label, taking this back adhesive part off, sticking that sticker right on there, putting this box directly into that FedEx bag. Once that box is in the bag, you'll close it, making sure all that air is out, and then take off this red piece here to seal it. You will then either contact FedEx for a pickup from your home, or even drop it off at a FedEx center. Our office does not ship out any specimens from our office to the FedEx, so we do require patients to contact FedEx themselves in order to get that taken care of. Once this is complete, you're welcome to resume your digestive enzymes, your probiotics, your aspirin, whatever the case may be. And then if you have any questions at all, just reach out to our office or your provider.